Deborah Leah Birx, born April 4, 1956, is an American physician and diplomat who specializes in HIV/AIDS immunology, vaccine research, and global health. 1. As of March 2020, Birx serves as the Coronavirus Response Coordinator for the Trump administration's White House Coronavirus Task Force. 2-3. From 2014 to 2020, Birx served as Ambassador at Large and United States Global AIDS Coordinator, where she was responsible for the President's Emergency Plan for AIDS Relief, PEPFAR, program in 65 countries supporting HIV/AIDS treatment and prevention programs. 4. Birx was born in Pennsylvania. She is the daughter of Donald Birx, a mathematician and electrical engineer, and Adele Sparks Birx, a nursing instructor. 5, 6, 7. Her late brother Danny was an accomplished scientist who founded a research company, and her older brother, Don Birx, is president of Plymouth State University. 8. Her family lived in Lancaster County, Pennsylvania, during her early life, where she attended Lampeter Strasburg High School. 7. Growing up, the siblings used a shed behind their family home as a makeshift lab for experiments in astronomy, geology, biology, and on one occasion, a homemade satellite dish antenna mounted on roller skates. 8. Birx's sophomore year she won third place at the Lancaster City County Science Fair, and she was featured in a front-page story in the Lancaster New Era with the subhead, "Girls Sweep Top 3 Prizes." 7. She told the Intelligencer Journal that, "Third is all right, but I'll be back. I want that first prize." Her junior year she competed in the International Science and Engineering Fair in San Diego. 8. Her family moved and she attended Carlisle High for her final year of high school. 9-10. Her senior year she competed at the Capital Area Science Fair and was awarded the grand prize. 11. Her brother says that her experience competing in the fairs really was part of encouraging her to go into science. 8. In 1976, Birx received a B.S. in chemistry from Houghton College, completing her undergraduate studies in just 2 years. 10. In 1980, Birx earned an M.D. from the Hershey Medical Center, Pennsylvania State University. 5. From 1980 to 1994, Birx served as an active duty reserve officer in the United States Army. From 1994 to 2008, Birx was active duty regular Army, achieving the rank of colonel. 9. From 1980 to 1989, Birx worked as a physician at the Walter Reed Army Medical Center. 12. In 1981, Birx completed a 1-year internship and did a 2-year residency in internal medicine. From 1983 to 1986, she completed 2 fellowships in clinical immunology in the areas of allergies and diagnostics, where she worked in Anthony Fauci's lab. 3. From 1985 to 1989, Birx was the assistant chief of the Walter Reed Allergy/Immunology Service. Birx started her career as a clinician in immunology, eventually focusing on HIV/AIDS vaccine research. 3-12. From 1986 to 1989, Birx worked at the National Institutes of Health as an investigator specializing in cellular immunology. 12. Birx returned to Walter Reed, where from 1989 to 1995 she worked in the Department of Retroviral Research, first as an assistant chief and then chief of the division. She was lab director in HIV-1 vaccine development for a year. Birx became the director of the United States Military HIV Research Program at the Walter Reed Army Institute of Research, a position she held for 9 years, from 1996 to 2005. In that position, Birx led the HIV vaccine clinical trial of RV-144, the first supporting evidence of any vaccine being effective in lowering the risk of contracting HIV. 12. From 2005 to 2014, Birx served as the director of Centers for Disease Control and Prevention's Division of Global HIV/AIDS, DGHA, part of the agency's Center for Global Health. 13. In January 2014, President Barack Obama nominated Birx to be the Ambassador at Large and U.S. Global AIDS Coordinator as part of the President's Emergency Plan for AIDS Relief, PEPFAR, program. 14-15. On April 4, 2014, Birx was confirmed by the Senate. 16. She described her role as ambassador to help meet the HIV prevention and treatment targets set by Obama in 2015 to end the AIDS epidemic by 2030. 17. Her role has focused on the areas HIV/AIDS immunology, vaccine research, and global health issues around HIV/AIDS. 2. As part of her work with HIV prevention, Birx created a program called Dreams, Determined, Resilient, Empowered, AIDS-Free, Mentored and Safe, a public-private partnership focused on reducing infection rates in adolescent populations. 18.